Whether you realize it or not, 3D printing in medicine is impacting patients' lives today. Here at the Children's Hospital, we've been printing hearts. In the field of congenital cardiology, patients born with varying types of congenital anatomy result in very difficult 3D structures where baffles have to be created through these complex structures. And in the world of medicine, we've graduated up from chest X-ray to CT, MRI, and even 3D hearts moving in front of us on a 2D screen. But there's still that missing element of really interacting with and understanding these hearts in this new dimension. And what we've discovered is when we print a complex heart, when you hold it in your hand, your level of understanding increases exponentially from existing technologies, especially in these complex cases. This process involves taking standard CT or MRI images and highlighting the anatomy in question of key interest. You can see in this graphic the highlighted heart, which is the actual reproduction of the patient's anatomy. As you peel the CT or MRI away, what you are left with is an actual reproduction of the patient's own anatomy. This takes personalized medicine to a whole different level. Once we have the three-dimensional digital model of the heart, we now have new tools available to us for how we can highlight the key points of interest so that we can approach it in 3 dimensions to improve our understanding of the complex nature of the anatomy. The VSD can be seen, the pulmonary atresia can be identified, as well as the patent ductus arteriosus. Depending upon the learner, there are multiple formats where we can take the 3-dimensional information and output it into either virtual or augmented reality or a physical 3D printed model. Each of these modalities has strengths and weaknesses, and we can target the format to answer the key questions identified for each specific patient.
When I'm talking to a family, I don't just present the problem, I present the solution. And so the more they can understand what the problem is or what's going on, the more real that solution becomes to them. My goal is to have them walk out of there with hope and understanding that everything can and will be okay, with everything that's going on. And so the ability to be able to show them that with the heart would be phenomenal. It's very exciting to see the possibilities with this technology and how we can use that, here in Peoria. It's truly amazing.